Presento volentieri questo documento che...
I'm pleased to present this short video which describes the work that goes on in the Centre for Integrated Medicine at Pitigliano Hospital, which I had the pleasure of seeing for myself during a site visit just a few months ago. I think that the concept of integrated medicine has been clearly developed by the centre's staff. As you will see after the presentation by the head of the facility, the staff are the ones who implement the fully integrated system for managing the semiological approach and its subsequent clinical and treatment-related outcomes. The integration of responsibilities and skills stems from an approach which follows different rules. These rules, however, are still coherent with the goal of learning as much as possible about the patient. The concept of personalized medicine, when looked at from different perspectives, enables the patient to get the best possible treatment for their conditions without favoring any one approach over the other. This is exactly the kind of synthesis we are looking for, and you will see in this short film how it can be effectively implemented.
The Centre for Integrated Medicine at Pitigliano Hospital opened in February 2011 and was the first state-run hospital in Italy to offer homeopathic and acupuncture services. 5 practitioners specialising in complementary medicine work here. The centre's medical services have been used over 6,000 times by members of the public who visit either the hospital's general medicine unit, the nearby neurological rehabilitation and orthopaedic centre in Manciano, or outpatient clinics. An appointment must be made and the required treatment charge paid for in advance. Under Tuscan regional regulations, the fee for the above services is the same as that charged for regular healthcare services. The integrated medicine clinics specialise in the following areas: osteoarticular diseases, rheumatology, chronic pain, oncology, allergology, dermatology, gastroenterology, and so on. Offering hospitalised patients integrated medical care at a public health institution has fostered a truly interdisciplinary approach to treatment. This modus operandi involves getting doctors from the School of Orthodox Medicine together with homeopaths and acupuncturists so they can share knowledge and work side by side in an environment where trust and mutual respect prevail. The interdisciplinary approach is based on 2 key stages: a morning meeting held between hospital doctors and doctors specialising in complementary medicine. At this stage, which is a key part of the shared medical management approach, the details of the clinical cases of hospitalised patients are discussed along with the possibility of using an integrated treatment method. The patient can then decide, by giving their informed consent, whether or not to proceed with integrated treatment. 98% of patients have accepted the integrated method. A joint medical checkup which enables current doctors and nurses to effectively share knowledge. This kind of medical examination means the semiological criteria used in conventional medicine, homeopathy, traditional Chinese medicine and acupuncture can be shared. The upshot is the ability to plan integrated medical care which can be easily understood by everyone involved. This way of doing things has met with the approval of the majority of the current healthcare staff. Both doctors and nurses have changed their minds about integrated medicine. They are now less skeptical, more open to new ideas, and feel more enthusiastic about their work. In terms of effectiveness, integrated medicine has led to significant improvements in the psychophysical recovery of the majority of patients who undergo this kind of treatment. For example, a study carried out recently in the Neurological Rehabilitation and Orthopedic Center in Manciano showed that, thanks to the integrated healthcare services provided in 2011, the mean functional recovery was up 20% on 2010, while analgesic drugs consumption dropped by around 70%. Let's now take a look at an example of an integrated medical examination with a special focus on comparative semiotics.
The clinical problem we're going to look at now regards Marco, a 50-year-old man who was approximately 30 when the symptoms of a skin disorder appeared on various areas of his body. Marco was subsequently diagnosed with psoriasis. Afterwards, Marco started experiencing pain in his joints, especially in his ankles, which was identified as the symptoms of psoriatic arthritis. First of all, let's examine the symptoms. Scaly patches of skin are particularly evident on Marco's hands, on both the back and palm. Looking at Marco's hand, there are typical signs of the onset of arthritis. These can mainly be seen at the distophalangeal joints. This symptom reveals an important difference from rheumatoid arthritis, which very rarely affects the DIP joints. A common indication of psoriatic arthritis is that all three finger joints are affected. If we examine Marco's feet for a minute, we can see that his toenails have been affected by the psoriasis, another very significant aspect of the condition. Currently, Marco mainly feels pain in his ankles. In the past, his knees were affected, especially his left knee. But now they don't hurt as much. We can conclude that at this time, Marco may need to undergo a course of non-steroidal anti-inflammatory drugs to tackle his pain symptoms, but not slow-acting or disease-modifying drugs, which are stronger and constitute the basic treatment for psoriatic arthritis.
La localizzazione delle lesioni psoriasiche.
The localization of the psoriatic lesions and the pain felt during the palpitation of the meridians show that Marco's disease is due to a toxic heat invasion of the liver, which is affecting the lung meridians and lung energy system, which regulates the skin, as well as the spleen-pancreas system, which regulates connective tissue. An indication of this is the structural transformation of the big toe, along which the spleen-pancreas meridian runs. We can see here the hyperkeratotic lesion running exactly along the upper and lower limbs. According to traditional Chinese medicine, the spleen-pancreas system regulates the four limbs. Another symptom to point out is the discoloration of the nasal alae and septum. This is also a sign of a toxic invasion of the liver and fits with the patient's medical history. Marco frequently suffers from problems related to the upper orifices, which brings to mind the chronic conjunctivitis and the deviated labial commissures, which in traditional Chinese medicine signify a shift in liver energy. The tongue is scalloped, which is a common symptom of a change in the liver. The tip shows that there is little bias for the healthy physic functioning of the heart. In fact, the patient informed us that his condition tends to get worse during periods of increased emotional stress. Another important point to note is the effect of the liver on the skin. The skin is supported by the lung, and here we can see a clear and significant example of hyperkeratosis along a crucial point, lung 9. This meridian controls the energy of the lung and tonifies it. All of this demonstrates the triangular concept of traditional energy medicine. The liver affected by a toxic heat invasion, causing spleen-pancreas deficiency and subsequently lung deficiency. Further signs are the intense pain felt at the liver points, beginning with liver 3, at spleen 6, which regulates the liver, at liver 8, which is very painful, and the patient has told us of knee pain, and finally at liver 9. All of these points are very painful and tell us that there is something wrong with the liver, something confirmed by the plethoric abdomen. The recommended course of treatment would thereby involve acupuncture at the following points: liver 3, spleen 6, a point where the liver and spleen pancreas cross, and liver 13, which regulates and harmonizes these two key systems. Moving on to the 5 movements, it is very important to look at lung deficiency when examining psoriatic arthritis. As I said earlier, in Chinese medicine, lung deficiency is directly related to the kidney, and thus bone and joint activity. As a result, lung emptiness has an immediate effect in terms of arthritis and arthrosis. And by using the pulse reading techniques of traditional Chinese medicine, we can begin to understand the medical history. So, to summarize, what can we learn from this? By taking a global pulse reading, we will be able to identify energy deficiency in the lungs and spleen pancreas, and an invasion of toxic heat in the liver. According to the principles of homeopathic medicine, a medical examination must take the patient's biotypology into consideration first of all. Marco's carbonic constitution reveals he is short-limbed, stocky, and has hypoplastic ligaments at the elbow joints, meaning they are somewhat rigid. Under the carbonic model with sulfuric elements, we should also take note of the rotundity of the abdomen, thus to conclude that the patient is a calcium carbonicium type. Well, under the reactive model, we can classify Marco as susceptible to the reactivity of the psora and psychosis miasmas. The alternation and frequency in skin lesions and joint pains, along with the presence of itching with a tendency to deteriorate, are typical of the psoric reactivity model. In terms of thermoregulation, Marco is suffering from prolonged exposure to the sun's rays, radiant heat. But his condition also manifests itself in cold, humid climates. Now let's look at the cutaneous lesions with a semiotic perspective. The skin is very dry, rough, and erythematous. Many silvery white patches of scaly skin have formed on the erythema. The plaques are broad with fissures on the palm and back of the hands. We observe a significant hypokeratosis of the soles of the feet, as well as in the toenails. Our examination of the symptoms and of the analysis of signs leads us to the choice of 2 homeopathic key remedies, petroleum and arsenicum iodatum. Moving on to the examination of the joints, the key symptom is a localized pain in the tibiotarsal joints, which gets worse when Marco is inactive, particularly in the morning and during initial movements. However, the pain tends to wear off with continuous movement. This profile fits with Rhus toxicodendron, and this kind of remedy is also closely linked to the type of cutaneous lesions we see on the patient. In terms of sensitivity, we have seen how Marco has a round abdomen, is hot-tempered, and shows some signs of depression. We can therefore conclude that the best course of treatment is the Similimum Lycopodium clavatum.
E anche una nota depressiva. In questo senso possiamo identificare come medicamento specifico un policresto molto importante, che è il Lycopodium clavatum.